I'm Dr. Susan Reynolds. I run a national consulting firm that does physician leadership training and development called the Institute for Medical Leadership. I've been a member of LACMA since 1982, and I originally joined, I think because I had to have privileges at the local hospital. But I met so many wonderful physicians in practice then. I was an emergency physician in Malibu, and I just loved the camaraderie. LACMA has been very important to physicians in LA County for many years, but I think now it has to be searching for a new mission, a new reason for helping doctors around the county. In the past, people joined because of the camaraderie. They found mentors there. They found help with their practices, solutions for troubling questions that they had. And that was a good reason to join. Also, politics is local. So meeting your assemblyman, meeting your state senator, meeting a congressman, or even a United States senator, there's great reasons to talk about your issues with these political people who can hopefully make a difference. I think over time, as physicians have gotten more and more burdened by the onerous changes in their practice environments, more and more reporting requirements, more and more legislation, regulations. There's over 1,000 quality metrics now that they can report. I think they've sort of hunkered down. I think they don't realize that there is some help out there. There's some other things that could be done for them that would make their lives easier. And then, of course, probably you get this answer a lot, jury duty. We all love that fact. You're only vulnerable for one day. So, of course, that's always been a benefit. I think this is a great opportunity for LACMA to start evolving into an organization that really meets the needs of physicians as they really try to focus on patients. Getting back to letting doctors be doctors. Let them be the kind, caring doctor at the bedside rather than just technicians pushing buttons in their EMRs. I think LACMA has an opportunity right now so that it needs to evolve. It really needs to figure out, why is it in business? Who can it serve? And I think if you're looking at the practicing doctor in LA County, they want to just be doctors. They're tired of all these other things they have, the flaming hoops they have to jump through in order to just see that patient at the bedside. I think LACMA needs to become much more interactive. I think it needs to be much more responsive. And it also has to be fun. One more thing I think that LACMA could do to add value to the doctors throughout Los Angeles County, and that is bring back real support for the districts. LACMA is a huge, huge county. The reach is too big for just to be managed by a downtown office. So we really do need more support at the district level. We used to have our own office and our own part-time staffer, and then District 5, which is the west side of the 405 freeway where I am, was vibrant. It was vital. We had a lot of members. But then when it got centralized, it's like LACMA didn't really exist. We vitalized it over here, actually, sadly, because there were 3 women's doctors who killed themselves from St. John's Hospital. And that galvanized the doctors in our district to get together to figure out, what was this? Why did we miss this? We had some support from downtown for the districts, and during my presidency, we were able to do 4 programs a year, 2 parties, 2 CMEs. That worked great. But then that was canceled, and most recently, we've had essentially no support. There's one person providing long-distance support for all 10 districts. I think if LACMA really wants to look at all that it can do, and especially politics being local, I really do think they need to look at how can they provide better, more consistent district support.